Good afternoon. I'm Joanne, Conroy, CEO and President of Dartmouth Hitchcock and Hitchcock Health, here hosting Facebook Live. Before we get started with our guest today, Tom Manion, who is the newest addition to our CEO team. He is the CEO at New London Hospital. I want to remind people that this is a participatory activity, so please put questions in the Facebook news feed, and they will magically turn up on my iPad, and I can incorporate your questions into the conversation we're going to have today. So thanks for making the time for being here.
Of course.
It's really a pleasure to have you. For those of you that may not have read Joanne's journal, when we first talked about your introduction here, I think we did it maybe a month after you got here. Yeah. You actually started like right in the beginning of the pandemic. So talk a little bit about your career history.
Sure.
Like the 5-minute version, and then talk a little bit about kind of what it was like to join Dartmouth Hitchcock Health in the middle of what we would say would be a tremendous amount of disruption.
Absolutely. So I started my career at Memorial Sloan Kettering Cancer Center. I actually began working in clinical trials and loved it. It was my probably the job that I had the most patient interaction, which was great to go into the OR, collect samples for specimens, and enroll people on trials, and et cetera. So I worked in a few other roles at Sloan Kettering, running the offices for the breast center, Evelyn Schauder Breast Center, and eventually in some of the billing functions in the back office. Living in New York City, we knew, my wife and I got married, we wanted to start a family. We saw how much a 1-bedroom apartment cost in New York, and trying to have more kids, it was going to be cost prohibitive at that point in my career. So we decided we were there for 6 years, we were looking for something new, and moved to upstate New York at Bassett Healthcare Network in Cooperstown, and began by running cancer centers there. Moved into the musculoskeletal group there as well, working with orthopedics, neurosurgery, and a few other services. And my last position there was working in the DSRIP program, which is a 1115 waiver ideas to reduce avoidable admissions by 25% over 5 years for Medicaid patients. From there, we moved to Vermont, where I was most recently, and working in the UVM Health Network at Porter Medical Center. I was the vice president of the Porter Medical Group. And it's interesting how identical Porter is to New London in terms of it's a 25-bed critical access hospital, continues to work on integration efforts with the system at large. And when I left, they had stood up Epic on the outpatient and rev cycle side. They were going to set it up on the inpatient side and ancillary side, but obviously when COVID hit, all that got bumped out, just like it did for us here at New London.
New London. Wow, interesting, same time frame.
Yeah.
So before we talk about your COVID whirlwind introduction to Dartmouth Hitchcock Health, it occurred to me though, you probably have a lot of friends still back in New York. And what was going through your mind in probably I think they really got hit in April.
Yeah, they did.
The stresses on the system there. What were your interactions with your former colleagues there?
Yeah, so, and I also went to grad school at NYU, and so we had people from Northwell Health to New York Presbyterian and et cetera. And New York Presbyterian was very good about talking about where they were and how they were supporting their people, or trying to. And it was the people who I know and I maintained contact with, they were desperate. I mean, they were trying to find help in any which way they can get it, whether it was pumps, ventilators, or nursing staff, things like that. It was quite difficult for them, and I know when people felt like they were turning the corner, they were just jubilant with hesitance and wanting to celebrate, like, we think we're out of this. And now that everyone's going back to school, there's a lot more that it's kind of rearing its head a little bit again too, with that nervousness, hoping that New York being very low in its incidence today, that they're not going to return to that point.
Yeah, they are really an example of a state that had tremendous demands on their healthcare system and have had really dramatic improvements in their endemic infection rate in the community. So now, thinking about life in the Upper Valley and in Vermont, where, people are sometimes shocked how low the incidence of infection is up here. When you talk to your friends in New York, do they say, you must be reading your facts wrong?
Well, yeah. I mean, there's a lot of people who are just, they're it doesn't make any sense. I mean, I can count on my two hands how many COVID patients have come into our hospital since it's all started. We have people who have tested positive, but were fine to stay at home and self-quarantine. But it's really low. It's really, really, really low. And there's a feeling of how lucky you are, but there's still I think the fear is still ever present, especially with the staff. We still have conversations with our ER staff about how we can best support them and looking at the science and the data and what type of PPE they should be using and things like that. So it's still this ever-present fear, and I think we're going to live with this through the fall, and hopefully in 2021 we'll start turning a corner and feeling a little bit more secure and confident. Yeah.
Really need to have a level of constant vigilance in order to protect yourself. I have a lot of family in rural Maine, and that wedding in northern Maine that led to so many infections in a state that prided themselves on their low infection rate was really kind of, I think, a blow to the community, and just tells us that we always have to be vigilant about that.
Absolutely.
So,
absolutely.
Yeah. I'm not sure I'd want to be the owner of that facility right now.
I don't think so.
So you had a lot of opportunities when you decided to maybe make a change from the UVM network. And for people that are on the Facebook Live, we have a great relationship with UVM. And before actually we offered Tom the job, I had to talk to them and let him know that we were recruiting you. He was not very happy, but he was accepting of the fact that it was a career opportunity for you. What really appealed to you about New London Hospital?
Yeah, so it was definitely a really hard decision. I still love Vermont very much, and I can't say enough great things about the leaders in the UVM Health Network and at Porter Medical Center. They're just stellar people, stellar individuals, and it was a hard decision for us. But with this, looking at the opportunity, sure, it's fantastic and something where we feel New London is a place where we can raise our kids and have a family and really put down roots. It's closer to my wife's family as well. It's they live in Massachusetts and Connecticut and Pennsylvania, and it's not half a country closer, but it's a few hours closer, and that counts for us, especially if little kids driving in a car. So it was something for us when we came here. We looked around the town. It was kind of an instant click. And then from there, once we got to work with the hospital and see the hospital and see what they're doing and where they're going, it was kind of easy to fall in love with. I'll also say the similarities with New London Hospital and Dartmouth Hitchcock Health mirror exactly what UVM and Porter had, and I think for me, I just felt like I had a lot to offer, that I could help the organization move forward in kind of its next phases as it continues to integrate with the system.
Now, how old is the UVM Health Network? New London was actually the first member of the health system, even though we started up the health system, I think, in 2009, 2010. I think it was 2013 until we added New London. UVM is still pretty early on in its infancy. I believe, I'm not sure if it was either Central Vermont Medical Center or Champlain Valley Physicians Hospital were the first affiliates. But Porter came in 2017, and there were a few others that came in along. So they're still a budding system. They're actually growing more in the New York side than the Vermont side. But they're new. I think is similar, very similar to Dartmouth in terms of what they're trying to do and how they're growing, especially on the medical group side, and how they're bringing in all the physicians into one fold. We actually meet with the executive team at UVM Health Network as well as Maine Health about 3 or 4 times a year, and there are a lot of things that we have in common.
Yeah.
I think Maine is a little bit more mature. They've probably been a health system for about 10 years, and actually probably started adding members earlier than we did, but we are very similar to UVM.
Yeah.
Let's talk a little bit about your transition, because I understand you have a rapidly growing family.
Yes, I do.
I think you deserve an award for the most children under the age of 5, but of any of our executive team members. So
my wife deserves the award. I'm just along for the ride. No, we have 3 kids. My oldest is turning 5 in September, so in a few weeks. My daughter will be turning 3 in October, and they both just went to their first day of pre-K nursery school today, which is kind of fun and exciting.
okay.
And then my youngest was born here at Birthing Pavilion, room 9. I have nothing but fantastic things to say about, I can't remember everyone's name, but I know Ashley and Jackie, the nurses there, were just phenomenal for us, and it was a really good experience. But yeah, we have a newborn. My wife was pregnant when we landed here through COVID, and some of the anxiety that came with that. And but we met the challenges, and we continue to do well. We count our blessings every day because we realize that we have so many things in life that are just fantastic, and you don't want to complain about how hard it is to have all these things and deal with it in this world, because there are many others who don't have what we have.
Yeah, that's right. Talk a little bit about the conversations. I don't know if you call them conversations you have with your 3 and 5-year-old. I'm actually writing Joanne's journal this week with the help of Ann Clemens on going back to school. So did you have any conversations with them about what daycare was going to be like? Because it's probably not what daycare would have been like last year.
Yes, we did. And I think, so my son actually had a day camp that he went to that required masking this summer.
Okay.
And fun fact, our CHRO, Amy Giglio, her son was also in the same camp. So we got to see each other at drop off a few times. But so he was more used to it, and he actually acclimated very quickly.
Yeah.
We talked a little bit about, there are some, I don't know if this is the best route, but it's the route we picked. There are some, cartoons that talk about viruses and what they mean and why it's important to protect yourself. And my son just instantly grabbed onto it and just trying to understand, why we're wearing masks and why we can't go to the playground. And obviously, some of those restrictions are dependent upon what's going on and who's there and how concentrated the area is. But they're aware of what's happening, and I think for them, they're navigating it very well. They're just resilient kids in general, but they understand that this is temporary. It's something we're going to have to work through, but we're going to do it so we can keep everyone healthy, including their grandparents, and how we make sure we're taking care of them.
Yeah. Well, that's great perspective. I know that there actually have been some interesting studies, like the YMCA actually maintained their child care for over 40,000 essential workers for the last 4 or 5 months. And they actually didn't have large outbreaks. There was a case here or there that they managed, but the real simple things that daycare professionals are well acquainted with, which is washing your hands, cleaning the toys in between. I think that daycare providers, have to wear smocks in between kids and have to do things that maybe they didn't do before, but they're super creative in keeping kids safe, but also showing them how much they care for them, which is the part of the socialization that's so important in daycare.
Absolutely.
So again, I want to remind people, if you have questions, put them in the live news feed and they'll magically show up on my iPad. And we already have some questions.
Okay.
How are you addressing the increased mental health needs in the community? No community is immune from really just free-floating anxiety about COVID.
Absolutely. So I think a few things. So mental health from the standpoint of how we're actually caring for patients who have mental health needs and caring for some of our patients who have psychiatric needs, medicine needs, has actually been very challenging for us due to we actually lost our psychiatrist throughout this process. And so working with Dartmouth Hitchcock Health to continue to on recruiting someone. But so I'll just acknowledge that that's a loss for us from a care perspective. In terms of how we're communicating with our community and how we're working with them to address these things, I'm sending weekly messages with a fantastic marketing and communications team who have been standing behind me and helping me do this on a regular basis, but almost weekly and in different types of forums, whether it's video or a message or something else. And we've really increased our emails and social media and other things so people can feel like they're educated. And I've actually received a lot of really good feedback from our community saying, this is so helpful for us to know what we're supposed to do because it's changed so much. You know, everything has just continued to rapidly evolve. And also for us to say, it's also safe to come back and we can take care of you in the right way. I think a lot of people are just terrified and don't know if they're really safe. And we've worked hard to do some ambassador programs where we bring people in to talk to them about what we've done to keep them safe and to help them go back out and talk to their community and saying, yes, we can do this. Don't put off your care needs. Come back and we'll be there to care for you. So kind of a combination of both mental and physical health, trying to make sure we're addressing the whole person and making them feel safe to come back to New London.
So I think your messages have been very effective. I've seen a number of them, and I'm sure the community really has embraced that. I do believe you're right. Once you get people in the door and they realize all the precautions that we're taking, it's probably safer than the local grocery store to actually come into the hospital and receive care. But there are some people that are still afraid. And we do hear that. You just have to pick up the Valley News, and you see stories about people that are afraid with the schools coming back and the, what it actually means for them. I think we're fortunate in that we have both the testing infrastructure, we've got the medical care that we can care for them if anybody actually needs anything more than support at home.
Absolutely, and I'll just also add the testing, working with DH Health has been fantastic from the lab perspective. We've been able to get results turned around so quickly because of our affiliation working with DHH. So it's been really, really good from that perspective. And I think we've come up with a lot of processes, again, derived from how we partner as a system and look at standardizing, which has been good. I'll also say we've set up our telemedicine program as well, which has been a great additional tool to the tool belt to help some of those patients who really shouldn't be coming in anyway. They shouldn't be going outside depending on what their situation is. And so I think that's been a really good tool to help, as best we can, help treat those patients.
Now, I can't remember, you do testing at New London.
We do.
Yeah. And I know that there's probably going to be increasing demand because some people for travel or school actually have to get tested within 72 hours. And I think they look to us asymptomatic testing, which we just started to do. Your wife probably had to be tested before she was admitted for her delivery. Because I think we do that for any inpatient. It's funny when people say, oh, the test wasn't bad. I sometimes wonder if they had the test performed the right way. Because I've heard, what did your wife say about the test? Because I've heard that it's actually pretty uncomfortable.
Yeah, she's watching right now, so I wish I could ask her, but I know, and she's told me it wasn't enjoyable. It was certainly something that, but it was only a second. It was very brief, but it was. Slightly invasive, but then afterwards you get peace of mind. So it's only a moment of having to deal with it. And you are right too. We are working with back to the in New London, working with Colby Sawyer College right now to do their first round of testing and trying to figure out what a second round is going to look like. So we are actively working with our community with testing, and it's gone really well. I mean, I feel we're in a place where we're taking care of our community by doing the right things, all on the eve of our epic go live, which is a lot of interesting, stretching thin.
There's a whole different layer of anxiety around that. So speaking of Colby Sawyer, and the next question we have from the audience is finding quality candidates for staff shortages, such as nursing. And people know that we've have a relationship with Colby Sawyer now, and You probably have a great opportunity actually being the facility within the town in which Colby Sawyer lives. So what's your interaction with the school over nursing and nursing shortages and clinical opportunities?
Yeah, so a few things. Number one, Sue Stubner is just a pleasure to work with. She's a phenomenal person as the president of the college and has done a really good job reaching out. And actually, I'll just say on a personal level, making me feel welcomed in the community, which has been really great. We definitely are very excited that we have the nursing program, and I think it's something we can continue to work with and seize more as they're growing. I'm interested. I haven't really connected with her to see how all of the nuances in terms of training and everything is happening this year with them, but it's certainly something we need to continue seizing that opportunity and continue partnering. I think the great thing with Colby Sawyer is that this is an opportunity for our system as a whole, especially here at Dartmouth-Hitchcock Medical Center, to be that pipeline that we all need. And I'm really hopeful that we'll continue to see people who come out of this program either come to New London or Dartmouth-Hitchcock Medical Center and feel like they want to continue moving between our organizations too. I think we all get better with that kind of cross-pollination, seeing different acuity and types of care, and I think it's a real win for us to invest, support, and work with the Colby Sawyer nursing program.
Yep, I agree. And we have actually talked to Sue and her and the Dean of Nursing and Allied Health there about other disciplines, social work that could really bolster our behavioral health services, and even some advanced nursing programs. So, our nurses can actually move up a career ladder locally.
Yeah.
So,
it's exciting.
All right, a lot of questions. As part of Dartmouth-Hitchcock Health, does New London Hospital benefit or participate in the healthcare training programs that we have, kind of our apprenticeship programs, such as the medical assistant and the LNA programs offered by the Workforce Readiness Institute? And are there any plans to really expand those?
So we do. So we absolutely do, and we have the providers I've talked to who get those folks from that program rave about them. Yeah. They love them, and I absolutely would love to continue talking about how we can continue the pipeline, continue to resource and support it, because I think it is a phenomenal thing for us. Yeah. I don't have enough good things to say. I can say a ton more about it, the individuals and the care they bring. This short answer is yes. Yeah. We're going to keep doing it.
Yeah, when you interview some of the graduates, that they feel like they get great training.
Yeah.
And now that we actually pay them to go to school,
right.
I think that allows a lot of people to take advantage of that program that weren't able to do it before.
Right,
so
right,
it's
exactly.
Great.
I agree.
Goals. So what are the major goals that you want to accomplish in your first year?
So I think, as I've mentioned a few times, I think the obvious ones are things like EPIC, right? We have to, turning on an EMR, electronic medical record, I don't think, there's a lot of work, but I don't think it's overly complicated. Anyone can turn it on. To adopt it clinically, to make sure we're using it, if you buy a Cadillac, you don't want to push it down the road, you want to drive it down the road. And for us, we want to make sure we're looking at this new medical record as a real opportunity, from looking at integration and how we communicate, how we schedule. We have a lot of providers coming and going between our site and Dartmouth-Hitchcock. We're purchasing their time. How we can better integrate and support our patients so they can get that right level of care ideally as close to home as possible in the way that's safest as possible. We have a ton of things set up along those lines, and I'll just say on a financial standpoint, we are not immune to, like any hospital, that we need to make sure we recover, and I think we still have a long way to go in terms of how we come out of that and looking at changing some things. So we have great programs set up that we're working on over this next year, with partnership from Dan Jansen, Steve Blank, Ed Marins, Pat Jordan, and many of the other senior leaders, Wendy Fielding, that are helping us do that. So those are things on the operational business side. On a personal side, I'm really trying hard to get to know every single person's name in the organization, and I'm batting pretty close to 1,000 right now. There may have been a few times I'm like, I'm not quite sure. They're wearing a mask. Is that Joe or is that Phil? And but for the most part, it's been really great. We're a small enough organization that I think it's really important that I can do that. The leader needs to know their people on that level, and it's been really good so far. Yeah, I've been enjoying it so far.
Well, I think when we actually look at the employee experience engagement numbers from across the system, sometimes our smaller facilities are our highest performers. And I think Joe Paris has set a high bar at Mount Escutney. He's the highest performing hospital in the state of Vermont and the highest performing hospital in our health system. I think he's a couple of years in a row, they've been above the 90th percentile.
Wow.
So, so yeah, he set the bar for you, but I bet you can exceed it.
That sounds challenge accepted. So you know, Joe. Yeah, no, that's good. I can't wait. I think employee engagement is one of the funnest parts of my job, and just getting to know people, round with them, talk to them. I think that goes a really long way. And also, you know, eventually when we do, speaking of financial recovery, getting back to investing in them in as many ways as we can. That makes sense, so that we can care for our employees, so they can care for our patients.
Yeah. Well, you've done a fabulous job really meeting people in the community. One question I have, so there was hospital days, I think it was maybe last month, and I think there is a tradition of the CEO being in the dunking booth.
Yes.
So how many people bought tickets to try to dunk you?
We set a record. I don't know if that's a good thing or a bad thing for my employee engagement, but we set a record. I know the dollar amount. I don't know the number of actual individual tickets, but it was a lot of people. And so, but because we're socially distant, we couldn't have a big crowd, but so instead, people would throw balls at the target to dunk me, but there's also a pull string, so that you have to pay like $25 or something to do a pull string to guarantee that I'm going to get soaked. And so my kids, my son Mac, my daughter Beatrice came, and they must think I have so much fun at work, because that's all they ever see are things like me getting dunked with water, or people are throwing stuff at me, and but it was a lot of good fun. It was I think my assistant Phil actually was able to hit the target once and dunk me as well. So it was and my wife. I shouldn't forget her. It only took her 2 throws to dunk me. So yeah, it was a lot of fun.
Well, you are doing a fabulous job, Tom, and we are thrilled that you're part of the health system.
Thank you.
And you've done just a great job really meeting the community where they want their hospital and their CEO to be, which is really a partner in community health. So,
thank you.
Well, thank you. And that's it for today. We want to thank everybody for tuning in. And this, of course, will be available for those of you that tuned in late and didn't get to hear all of it. But thank you again for joining us on Facebook Live.